Okay. Good evening, everybody. Welcome to our webinar this Tuesday evening. So glad to see some people on here. And just verifying a couple things before we get started. All right. I have a co-presenter that's offline at this time. If someone can just send me a message in that little chat box if you see how to do that, and let me know that you're hearing me okay. I'll just encourage everyone else will stay muted and off video, and we'll get started. Now, as you might see that little box, you can see there's a little area for questions. And I encourage people to get on there and just put in some questions for me. And at the end, we'll be able to go through that. And at any point that there is any technical issues, there's a phone number right on the slide right now. You should be seeing our Take Control, Inspiring Tools and Tips for Becoming Your Own Diabetes Coach. And technical difficulty support number is right on the bottom there. My name is Ashley, and I'm a certified diabetes care and education specialist with Cecilia Health, and I'll be your host tonight. I'm going to start clicking through some slides. Again, so glad to have you guys on this evening. Except it's dark and cold, most likely where you are, so it'll give us a nice time to spend together. So here's an example of how this is an interactive program. Our format includes a short presentation, which I'll be doing, followed by an interactive discussion. And that's where I can invite you to put questions in that little box. Just type something in, send it along, and I'll have those at the end. And you can do multiple questions all throughout the presentation. If you have a few, just put them on in there. Now, yeah, I think that's pretty clear. Just want to read through a little disclaimer. We know that information you're about to hear may motivate you to make lifestyle changes. Please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Educators will provide strategies to help manage your diabetes. The online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Educators. Yeah, what we're going to talk about tonight is going to walk through each of these things using my PowerPoint slides, and you're just going to hear a lot of my voice. Why problem solving is important, how attitude and mindset play a role, finding information and seeking support, problem solving tools, problem solving in action, which we will do a little example at the end, and then of course our question time at the end. And yep, I believe I put a little picture of myself on there. I am Ashley, and I am over in Ohio. I don't know where you folks are tonight. I might have some colder areas than me, or maybe even warmer areas. I am like I said, certified diabetes care and education specialist, and I'm also a certified medical surgical RN. I spend a lot of my time in the virtual health environment, using interactive tools like such as video or phones to talk to people from a distance and help with diabetes. And I also work at an acute setting hospital where we have lots of different variety of types of patients, really straightforward, a lot of medical, surgical, general type things. So I get exposed to diabetes on a variety of aspects. And I've been a nurse for about 18 years, and I'm in Ohio with my 2 teenagers. I have a 17-year-old son, and I am having, a 15-year-old daughter who's at a swim meet right now, just finishing that up. And I've been married for about 20 years now. I have been very, very blessed, especially lots of thankful things around this season. All right, well, let's just get this. And just, I'm going to pause just a moment All right, so jump right in here. Why problem-solving skills are important. Oh my goodness, diabetes needs change every day because there's things come up like stress, medication, changes with physical activity, diet. And keep in mind, and I keep hearing this today, I heard it so much on my phone calls with people. I don't know what's going over in Minnesota, but everyone has colds right now. It's like sickness has really started. So some people that weren't sick a few days ago are now sick, and they're dealing with that. And that's life, right? Just constant change. But the point of tonight is to talk through how we can kind of go with that, and we can have good problem solving skills in our head to be able to just be equipped to think through this stuff better. So that's why I want to really make a difference with you guys tonight. For example, changes in medications, physical activity, sickness, stress can all impact our blood sugars. And if you didn't know, even periods of stress may often make it more difficult to control your blood sugars. And this means like physical and emotional stress. So we're coming around the holidays times, and coincidentally, some people may see blood sugars a little higher in that time because of all the extra stress. So that is certainly possible. And it's good to identify it so we can work on improving. And next point there is diabetes needs change gradually over time. And I really love just emphasizing the point that, 5 years ago, 10 years ago, we're not quite the same person. You can see with your body, even my own, that we're aging, we're changing. Kind of the same thing is going on with our body inside. And the longer you have diabetes, it is a progressive condition. So it does get a little bit harder to manage over time. And that's because, like, say our pancreas gets a little more worn out, maybe a little tired, doesn't produce that insulin as well as it used to. And our body doesn't want to use that insulin as well. And that's the insulin resistance problem, when our body doesn't want to use the insulin as well. And I don't know about you, but a lot of people I talk to are in the time of life where they're retired, maybe change of seasons, and that is an exciting time, but a time that even brings changes. But the most important thing is that most diabetes situations do have solutions. So although you may feel overwhelmed in these situations, the good news is problem solving is a skill that can be learned, and there are often good solutions. So sometimes you just have to be creative and a lot of trial and error, I like to say too. So let's look at this next slide. And it's all about perspective. And I find as like a health coach, a diabetes educator, that I'm really pumping people a lot up to be positive, to be encouraged, because any condition that people have, it takes a toll mentally to manage, especially diabetes. That's a chronic condition and usually not a condition that you have by itself. There's usually other things going on too. So it's important to be positive in this problem-solving approach. And when managing diabetes, the problem may not be solved by the same method you used before. So you have to be willing to try new approaches. You're going to have ups and downs. And if you expect that going into it, we'll probably deal with things a little bit better. And not only do we have to believe that the problem can be solved or improved, ideally, but a positive attitude goes a long way as it helps us explore possibilities and think of creative solutions and makes us willing to try a new way of doing things. I also was doing some personal study with mental health and mindset approach to things. And I was recently read that people that set goals and are able to meet those goals, and just having those goals set just really improves a mindset. So I just encourage you to be even making it a lifestyle thing to have goals in your life, to always shoot for something better. And that last bullet on there, consider trying something new as an experiment. I think that's what I meant earlier when I said trial and error. And we'll give some examples as I keep going with these slides of what I mean about that. I have a good example today from someone I talked to. I think I talked with her 2 weeks ago, and we're talking about nutrition and just starting out. And I encouraged her to maybe think about food logging because she sounded like really on top of it and super excited to try something like that and make changes. So she did that. And I talked with her today, and she was telling me what an eye-opener that food logging was, because she didn't realize how many cookies and pastries she was consuming. And I thought to myself, well, how did you not realize how many cookies and pastries? But really, sometimes you just get in the habit of drinking things that are sugar filled or added sugar, just habits that you don't think about. But when you're intentional, your eyes may get open. And she really saw some positive impacts with her blood sugar. Not only that, but she felt better and was more confident in herself. All right, so teamwork. Who's gonna help? So remember, you don't have to do this alone. You're not meant to do things alone. People are meant to have support. Don't be afraid to ask your team of healthcare professionals, as we're here to help and support you. You can also ask your diabetes educator or your local diabetes association about support groups near you, as most even local hospitals or bigger hospitals have maybe diabetes centers, some established support group, where you can even search for diabetes discussion groups or discussion boards on the internet, because there's a good chance that someone else has the same problem as you. And remember, just word of caution, people that have diabetes, we talk back and forth. Everybody has different experiences with their diabetes, but everybody's diabetes is different from the next person. Sure, we have the same pancreas, the same cells, insulin, all those key words are the same. But when you put those in an individualized way, everybody's diabetes is going to progress differently. For example, no two people respond the exact same to a piece of pizza and a glass of milk. Go for a 20-minute walk. Someone's blood sugar is going to do one thing. The other person's going to do the other thing. We can expect and plan for certain things, but keeping in mind, just because one thing works for one person, it may not work for your own condition, because this is your condition. It's yours. You own it, and you're going to learn how to manage it. But I want you to feel supported when you're doing that. And there's a little website on the diabetes.org. That's like the American Diabetes Organization website. You can actually put in the zip code and even search. So it's kind of nice. You might be surprised what's right around the block. And here's just some more areas of finding information, because the more informed you are, the more you read, the more you're exposed to, the more you'll start to put things together, because it'll make more sense. You're going to read the same kind of terms, hear the same language, see some example experiences, read some articles of these new types of medications. I just read a little article today about how they're showing that consistent alcohol use is really being tied to higher blood pressure levels. So they're really coming out with some research that's showing like, hey, heart healthy, we might need to be even more cautious with that alcohol. So just kind of seeing what's new on things, because there's a lot of things that change too. So let's go through these bullets, just some examples. So if internet access is an option, you can find a lot of reliable information on the National Diabetes Education Program, like the American Diabetes Association, which I'll refer to as the ADA, and other reliable websites. I'm pretty sure I learned this in college, and I'll never forget it. They told me like a reliable website is going to end more in a .gov, G-O-V, or a .org, and that's a good way to find out if things are reliable. And there's some examples on there on your screen. The large diabetes supply companies and pharmaceutical companies like Eli Lilly, Novo Nordisk, a lot of them also have good resources on their websites for diabetes management. I think you'll find that with most like drug companies, they'll really put a lot of, like if I was looking up a COPD like inhaler, on that website, they actually have a lot of good, credible information, and that's on sometimes very user-friendly, patient-friendly type formats and videos. There's a lot of things out there. And if your computer access is limited, yeah, we like to mention that you can call 1-800-DIABETES and have printed material even mailed to you. And sometimes at your doctor's offices, it doesn't hurt to ask. You could even ask for them. Say they're prescribing you a new medication, or they reviewed with you target levels for your blood sugar. You know, if you're not someone that's going to have internet access and you're afraid it's not going to be on your after visit summary, ask someone to print something out for you as a resource. I would do that same thing for someone in the hospital setting. If a patient would ask me for some information on their post gallbladder procedure that they can read up about it. You know, healthcare people are willing to help you in any way that we can. And if printing information is an option for you, please ask. Another great option is to just subscribe to a National Diabetes Patient Magazine. And sometimes they just only cost $10 to $15 a year. And it's Christmas time, or there's always a holiday or birthday or Mother's Day or Father's Day, and maybe you can ask for a magazine subscription. They have a lot of good solid information and often have tasty recipes. And there's, no, I don't think we have examples on. Yeah, there's some examples on there. Diabetes forecast, diabetes health, diabetes self-management. And I like to say, I have it's called Libby. People use Overdrive, like where they can actually access their local library resources on a device that you sign in with your library card. If you're not sure what I'm talking about, maybe even a family member could help you, or your local library. But I actually can download magazines on like a device from the library and look at them on my phone. And I've done that to look up recipes and things like that. Sometimes the real magazines are real nice. All right, well, let's go ahead and jump over to this. I hope you're staying with me. And just a reminder that if I say anything that maybe spark a comment, question, feel free to take that little question box and put in a question. That'd be great. All right, so let's talk about some of the most important tools to help problem solve, and that is keeping records. Because I don't know about everyone else, but my memory's not that good. I might think, oh, I'll remember day after day if things are certain. No, write things down. Logging has been shown to have such good positive effects, kind of like that example I shared earlier about that woman that was doing food logging. But also, for example, when you write out your blood sugars, you can see trends easier and you can see more information. So let's just talk about some examples of that. Right. So, by what, when, and how much you ate, especially carbohydrates and alcohol. Yeah. So why the carbohydrates are important is because they're the foods that generally are going to affect your blood sugar more. So carbohydrates are foods like a milk family, like the milk, and the starchy grain family, like the breads and cereals, starchy vegetables, rice, kind of all those starchy areas. And okay. And then also, if you're going to start food logging and looking at those things, I really encourage you to be mindful about your drinks as well, because a lot of times there's some hidden sugar in there. If you want more information on food label reading, and that's not something we're going to get to this webinar, but here's a great example of how you could go to the American Diabetes Association website, if you had access to that, and even be able to print a couple sheets on food label reading. Or just getting some basic education from a coach or doctor visit. It could really help you go a long way when you're trying to recognize the foods that have carbohydrates. And if you notice a pattern of high blood sugar every time you eat a certain meal or out at a certain restaurant, you're better able to fix that problem. Over this last summer, it stuck out so much to me how many people really learned a lot from when they ate watermelon, as an example, and their blood sugar would raise so much from that. I found that so consistently. I started asking people just directly if they were doing any kind of eating, like extra melon or watermelon, those summery sugar fruits, because although fruits are so good for you and should be included, we want to still eat them in a moderate way, or they can do the opposite good and make your blood sugar too high. So what kind, when, and how much medication you have taken. So some people have diabetes and they're not on medication. But for people that may have had diabetes for a while, maybe it has progressed where you're on medication. It depends on, what kind of pills or if you're on insulin. But that's directly something to learn and discuss with your doctor about. If your medication is affecting your blood sugar well enough, or if you take too high of a dose, your blood sugar could go low. So even the timing of your medication can affect a lot of things. Making sure you understand how your medication works is also important, because when you understand how it works, you'll understand how the effects play a role in your diabetes and maybe how you can manage it. Other than food, medication, of course, exercise. Who was ready for me to bring up physical activity in the time of the year where many people are, I tell my kids, going into hibernation time, which with the dark evenings and cold outside, it's easy to become a part of the hibernation crowd. And that would be a great example of if you start seeing your blood sugars raising and you know that you haven't taken your usual walks outside or bike rides, because we pretty much had to put the outdoor bike away, and maybe you don't have any indoor equipment. So now you're just a little more sedentary. You may see your blood sugar start raising. But we can think of the other side too. You just got a gym membership and you really started doing a lot of working out. You love this rowing machine and you're really hitting it hard. But when you come home, your blood sugar's low. So you start thinking, okay, I need to have a snack before I go do that rowing machine, and then see how that makes a difference. Write it down, learn from it. Learn from it. There's some tracking tools over on the right side of your screen. And I'll just kind of point out a couple examples of those because I'm thinking of some right now just as I talk about exercise, and I encourage you even to track exercise. Tracking is so important as well because it helps keep you accountable, and it can help see if you are meeting goals. There's really a lot of people benefit from that. But there's some good ones out there like that don't cost anything, and if you have an iPhone, there's some great ones that are like default on your phone program. But MyFitnessPal is a really common one that people use for tracking physical activity and other things. Logbook companies, logbooks can be available from meter companies. I find that it's not as easy to get them like it used to be, but it is easy to find printable logs that you could even print. Some people just write like writing on a notebook. Some people, I was just talking to someone today, they download their meter that they use actually connects to their phone, so they can even print them out to look at, print them out to take them to the doctor visit. Online record keeping system. Yep, those are great. Phone applications or programs for smartphones. I went over some examples of that. There are probably thousands upon thousands of phone apps at this point, but I find the ones, when I'm trying to find the best ones to use, I look for the ratings and the fact that it's no charge perhaps, and I look up like maybe the best diabetes tool or tracking device of like 2023, and it'll give you some examples. A lot of consumer guides review these things and can give you some good examples. All right. Oh, and a couple of things I didn't point out on that keeping records was know about times of high stress management techniques you try. sneak peek, I think something about that's going to be coming up in this example I have soon. Yeah, times of high stress. I talk to people constantly that are changing situations. Sometimes when I try and coach people, I find that they often, sometimes, and this is how I tell if they're really not ready for coaching. Unlike you people, you're attentive tonight, and I appreciate you coming on. But sometimes they're sick or they're moving houses, and then the next couple weeks their son has basketball games, and there is always things going on in life, and there's never a normal day 7 days out of the week. There's always going to be things changing. I think we said that like one of the first slides tonight. No day is the same. Diabetes seems to be changing a lot based on what's going on in your life. But remember, we're just trying to equip you with ideas and thoughts so you can work through this on your own. Okay, ready to change from this slide. Oh my goodness, I'm ready for my little example already. All right, I think I'm ready to go there. We'll talk about little Sarah here. Now, Sarah, she's pretty excited. She looks like she's ready for the cold weather. Well, Sarah has type 2 diabetes, and she's treated with oral medications. So she has changed jobs recently. In her new job, she feels self-conscious about checking her blood glucose. When she gets home, her blood glucose is often higher than she wants it to be. Okay. She is trying to figure out a way to control her blood glucose during the day at work. Okay. This seems like a pretty straightforward example. If there's a problem, we want to see if we can work through this. And we know that there's a solution, right? Because we had that in one of the slides, and there will be. There's things we can work through. So although she has a lot of change going on in her life, hopefully she'll go about this in a positive way, knowing that there's going to be trial and error. There's going to be ups and downs. Some days are going to be better than others, but as long as she still keeps trying to work up the ladder. All right, I think we'll go on to the next one. Now that we got our problem, let's talk about our problem-solving process. So we need to figure out what is making her blood sugar high. Here's some examples. And we know that we don't have lunchtime blood sugars to solve this issue. Oh, man, the more information we had, the better it would be, but sometimes we're just going to do our best without it. Sometimes if she doesn't want to check her blood sugar at work and that's an out and we're not going to have that, then we're just going to try and problem solve with the information we do have. So going back to the tools we talked about earlier, Sarah decided to keep record of her food, physical activity, and stress. Maybe she used paper records. Maybe she found a good app she liked on her phone. Maybe she just kept it in a little notebook on her purse. Now, you really do just find what works for you. And by keeping records, Sarah discovered that her lunch hasn't changed, but has noticed higher stress levels while learning the new job, and that she's walking less. So let's look at it. Lunch is consistent and same before. Because a lot of times you'll think, what am I doing different? Between medicine, physical activity, how you're eating, and like emotional things, what has changed? So her lunch has been the same, but she is noticing that she's definitely more stressed and walking less. Okay, so now she's reflecting. Now she's trying to find a solution now. We can all relate to Sarah in one way or another, where she's just trying to work through this. So she discussed her concerns with her certified diabetes care and education specialist, and together they troubleshooted and decided on a plan. So Sarah needed lunchtime and afternoon blood sugar results. To make Sarah more comfortable with checking at work, Sarah's checking her blood sugars discreetly in the bathroom now, using a smaller, faster meter. So she can check to see if it's stress related that's related to higher blood sugar reading during the day, or a decrease in physical activity. So maybe she would experiment and check it on a day where she's really stressed, and then take it on a day where she's like mellow and having a nice day and can kind of experiment. That's what experiment kind of means with that. And Sarah also did some experimenting by increasing her physical activity and using stress management techniques. and observed which of these actions worked to lower her blood sugar. So remember that why we're talking about all this exercise and blood sugar, like how does it relate? I just want to take a step back and say, when you are physically active, that helps your body be less insulin resistant. So that means your insulin is going to work better when you have used up more blood sugar with that physical activity. When you've gained some muscle, it's going to help your insulin work better, whether it's the insulin you still make in your body or that insulin shot, like Sarah, if she was on insulin, would have took before she worked. And so, and if in this example, we are really talking about other things other than medication, but keep in mind, if Sarah was to also be doing these good changes and still had some frustrations, we could always consider medication changes or talking with her doctor about that. So she problem solved. So through her mini experiment, Sarah learned that the breathing exercises helped improve her blood sugars a bit, but they're still a little high. Sarah also experimented with increasing her physical activity, parking further, walking stairs more, and even taking a brisk 15-minute walk after lunch, where she discovered her sugars were now in range. So she's pretty excited. And maybe you're even thinking in your head some ideas that you would have done if you're Sarah, that maybe Sarah didn't think of yet, or maybe at some point she will. We all have different ideas, and that's kind of one reason why it's nice to reach out to other people and support and look for education where we can find education, because there might just be ideas we haven't thought of. So Sarah plans to continue her daily increased exercise and incorporate breathing exercises on higher stress days, as she's happier with her blood sugars, feels better during the day, and when she gets home in the evening, she feels like she's in control of her diabetes now instead of the other way around. Yeah, that's really great. So that's how we work through a problem. So we have reached the end of that discussion on problem solving. So I want you to use that correct question tab. I'm just going to give you some time in a moment. If there's any questions you have about what I went through or other questions, I could be open to answering some things tonight since we have some time. And if you'd also like to share a diabetes management tip that worked for you or something that you learned with your own problem solving. Okay, now I'm going to try and get up to my okay. I'm not gonna answer questions yet because I'm gonna give people some time to enter, and then I'll go through what I have. I thank you for the questions coming in. Okay. I think I am ready. Okay, I'm gonna improv this. Is there a formula for the number of insulin, Novolog or Lantus? So a Novolog is an example of a rapid acting, very fast acting insulin, or Lantus is a long acting. So the person's asking, is there a formula for the number of insulin, Novolog or Lantus units to drop glucose numbers? I'm gonna guess that means by points. That's a really good question. Now I want to first say that you shouldn't do any changing of your number of insulin units without talking with your doctor first. Some doctors will give a little direction, or even some certified diabetes educators can provide some direction. Usually we like to base on doctor or a nurse practitioner order on medical treatment. But for an example, Novolog and Lantus are two different insulins. So I'll just quickly give an example for maybe Novolog. And it's going to be the most basic answer I can give you for a very complex question. And this is actually a very good question. This is someone that is trying to probably tailor their insulin as best as they can to keep their blood sugar under control. So Novolog is a rapid acting insulin. So how much everybody needs may slightly be different. If we're just talking about a correction amount, sometimes people will have a often called sliding scale insulin or correction insulin based on their blood sugar that their doctor has given them, kind of some ideas on how to adjust. Like for example, if someone had a correction scale where they were using their Novolog, if they tested their blood sugar and their blood sugar was, let's say, 175, they would look at this scale that the doctor had provided, their healthcare provider provided, and in the range it says if your blood sugar is between 150 to 200, they would like you to administer 2 units of the Novolog. And that 2 units would hopefully bring down the blood sugar down to a more normal level. So in that example, a Novolog at a 2 units is said to show some improvement. But again, please make sure you talk with your doctor for any kind of scale like that. And also some people that carb count and use Novolog insulin, that would be also kind of like an more additional answers. That would take a little bit of time because that is a complex one. People have different sensitivities to insulin. I also want to mention to that. Some people will be on a more sensitive scale. And for someone like this asking the question, for them to get the best information as they experiment, maybe how their body responds to this rapid acting or even the longer acting Lantus, wearing a CGM, a continuous glucose monitor, will give an exceptionally great amount of information to even answer that question further. And most of the times the doctors will use some kind of scale on your starting uses of Lantus and adjust you based on your blood sugar results. They can adjust the Lantus. Okay, that was kind of a wordy response, and I'm sorry if that wasn't more clear. Okay, I'm trying to scroll down to my next question. Bear with me a moment. And again, that was a good question. It was a really good question. More of a question for the doctor with the dosing of the insulin. I cook mostly from scratch. How do I determine number of carbs? Oh, that's a fantastic question too. And at one point, I had someone ask me this question in a support group, and I had a colleague, and I swear she told me something like recipe ID, but now I'm not certain if that's a website that's actually legit, where it was actually where you can put in your ingredients and your serving, you know, that actually ID your recipe. Yeah, I don't think that's a real website anymore. And so my best thing that I can tell people is just try and do your best at measuring. Like, I know people are making soups this time of the year and they got a bowl of vegetable beef and they're like, okay, how many carbohydrates is it? And sometimes that can be really hard, especially, first of all, you're going to do your best identifying the things that are carbohydrates in the meal that you're making. And hopefully you can, if you know you're using 2 cans of beans, and it's casserole, and that's the only carbohydrate because it's a bean and vegetable casserole, then hopefully you can just read your serving label and know how many total grams of carbs are going into that meal, and then you're going to have to do some division, because that making from scratch is an excellent thing to do because you're avoiding dining out, fast food, processed foods. But it does take a little bit more math and consideration and measuring and estimates when you're trying to really come up with a good carbohydrate number. I know when I've used MyFitnessPal app before, because I love their record keeping, and MyFitnessPal, the most basic plan is free still, which is nice. They have where if I plug in their chili, it'll pop up, you know, are you eating Bob Evans chili or is this homemade chili? And they'll kind of give a lot of examples of how much a cup of chili is, homemade, certain ingredients, and that I've found really helpful before. So sorry, that's the best example I can share. And also, one more thing. I really like this website that the American Diabetes Association has. It's my most favorite one for looking up recipes. Diabetes Food Hub. That's Diabetes Food, and then HUB as a boy, Hub. And they actually have recipes, and then they even break down like how much ingredients and carbohydrates would be in each serving of meal. So check that out if you haven't had a chance to. Thank you for that question too. Okay, just scrolling down. I think we have just a couple more. Thank you for the questions. So here's someone that maybe is not quite sure about target levels. So here's a good question to take us back after that nice complex one about the insulin and glucose. But what they're asking, they wake up in the morning and they just started testing. Doctor gave them a meter. Okay. Oh, this is a challenging situation. So what should my blood sugar be when I wake up? And when should I check? Before meals, after meals? Whew, that's a good one. It's also a good one. So I'm glad you decided to start blood sugar testing for one thing, because it is absolutely a great way to kind of see the gauge of how your diabetes is. And sometimes you're going to get some good news when you check, and that can reinforce that you're doing a really good job at what you're doing. But in the morning, your blood sugar should be, and this is per the American Diabetes Association, they recommend a goal of between 80 to 130 in the morning. And then if you do decide to check before a meal, is pretty much the same range, between 80 to 130. So fasting before a meal is going to be the same target range. But then if you do a post-meal, wait about an hour and a half, 2 hours after that meal, and if your blood sugar reading is at or under 180, that's good. That's good, because we know when you eat food, it's going to go up. Your blood sugar is going to go up, but we'd like it to be able to come back down. So that's the key part of why we encourage some after meal checking occasionally, especially if you're trying to learn how food is impacting your blood sugar. And that way, if it's staying above 200 and, it's like 230 2 hours after you ate that loaded baked potato, then, okay, we're going to cut the baked potato in half, maybe load up on the broccoli a little bit more next time. Yeah, so, and then how often you should check, you're going to want to ask the doctor that. And then most doctors should give you a recommended frequency. And if they didn't, this could be a time when a coach or an educator can help you. And it depends on if you started a new medication, what your A1C going into this is, some more things like that. And here, I meant to say this earlier, and I just want to say it now. Remember the purpose of why you're doing this extra step and why you're caring about yourself so much is so that you stay healthy and good quality for your life, because keeping your diabetes under control decreases the risk of complications. So that's why you're thinking about this problem solving and logging and doing this extra steps that hurt your brain sometimes, but that'll ultimately help you, is because you're trying to decrease the risk of complications down the line. Okay, and one final quick question I'll try and answer. It says, I use metformin, I can't seem to get my blood sugars down, and do I have to go on insulin? Okay, yeah, this is good. It's good. They're saying that they even go for daily walks, and it's just been really hard to control. So good. That's a really good question too, especially when you think about some people that are on pills and some people are on insulin and how diabetes does progress. And this person sounds like they've done some changes, especially with the walking. So if you're seeing consistent highs, and those would be higher than the target levels I just reviewed, then even with, and then especially with symptoms of high blood sugar, like, being thirsty or especially tired or blurry vision or really hungry, really thirsty, have those symptoms, and even with like a high A1C, and that would be greater than 7%, a high A1C, then even your doctor would need to talk about what's going to fit you best. People with type 2 diabetes may or may not ever need to take insulin injections. Several alternatives to metformin are available. Metformin is like the first line of medication therapy for diabetes and pre-diabetes, so it gets prescribed a lot because it's still doing a good job, even though it's been around a long, long time. But there's some newer ones out there. So you can talk with your doctor about things like SGLT2 inhibitors or GLP-1 agonists that even offer some benefits to your heart and kidneys and even weight loss, if that's something you're still working on. And others, like there's non-insulin injections, could even be useful to add to the metformin. So again, this would be a great time to talk with your doctor and get equipped for that doctor appointment by maybe visiting the American Diabetes Association website. They have a whole list of medications and how they work and options that are out there for you. So sometimes metformin will work for years and years and years, and then because of the progression of diabetes, even though you may be doing everything else the same and so many good things, it can still get challenging and get to the point where you may need that additional medication. Don't feel like you did anything wrong. All right, well, on that note, that was a nice little question and answer segment we had. Last chance, I'll watch the question thing, but I think we're good, and I will go through my last few slides. Thanks for paying attention to me. And we have some upcoming live events. Let's see. So we got January, the new you for the new year diabetes resolutions that stick. So that is available. And the one in February is really good. That would be a good follow-up for the person that asked about the metformin and other medication. I often would tell people that I was coaching to watch this webinar about all the medication tips your doctor never told you. It's just a way to be informed about medication because those discussions do come up at the doctor's office. It's better to be equipped for them. If you want to attend more events, ask your clinician or reply to one of their emails, and they'll share all available online. You can sign up for text messages, and we have a Facebook page that is available as well. On that note, I thank you again so much for spending some of your evening with me, and I hope you have a good rest of your night. And I'm going to go ahead and end the webinar. Have a good night.